Nursing 474, Teen Pregnancy. The weekly learning objectives include use evidence-based practices to care for vulnerable populations, choose strategies that can be used by nurses to improve the health status and eliminate health disparities of vulnerable populations, including governmental, community-based, and private programs, produce a resource list which could be used by vulnerable populations. Adolescent health care in the United States. Adolescents are generally healthy, and when they seek health care, it is for reasons different than those of adults or younger children. The main causes of teen mortality are high-risk behaviors, including motor vehicle accidents, homicide, suicide, and accidental injuries. Teens often engage in behaviors that put them at risk for life-threatening diseases. In recent years, surveys of adolescents have indicated that some behaviors are decreasing, whereas others are on the rise. Teens have limited experience with independently seeking health care. When they do seek care, it is often to discuss concerns about a possible pregnancy or to find a birth control method. Teens may need assistance in negotiating the healthcare system. Special approaches in both the client interview and subsequent client education are often warranted. Teen behavior during an interview may be difficult to interpret because these encounters are stressful for the young person. Because client interviews begin with evaluation of the chief complaint, teens need to know that their concerns are heard. It is also important to pay attention to what the teen fails to verbalize. Knowledge of adolescent health care issues is valuable so that nurses can anticipate other health care concerns and provide an environment in which the adolescent feels safe about raising concerns. Although most minor teens consent to birth control services in the United States, there is great variability in who may access and release their medical records. The Health Insurance Portability and Accountability Act privacy rule established that if a minor consented to care, then only that individual could access and release those medical records. However, the privacy rule also differs to existing state law. Therefore, nurses must be extremely knowledgeable about state and federal laws so that they can accurately inform adolescents of their rights and limitations on seeking reproductive care. Trends in adolescent sexual behavior, pregnancy, and childbearing. Births by teenagers make up 11% of all births in the United States. More than 6% of the teens are unmarried at the time of their child's birth, and fewer than 8% of these unmarried teen mothers will marry the baby's father in the year after the birth. Many adults have difficulty understanding why young people would jeopardize their futures by becoming pregnant during their teen years. Adolescents do not view the world the same way adults do. They often feel invincible and do not recognize risk related to their behaviors, nor do they anticipate the consequences. The Healthy People 2020 goal is to increase the proportion of adolescents who have never engaged in sexual intercourse by age 17. Birth control use among teens has improved. Healthy People 2020 addresses this with the goals to increase the proportion of 15 to 19-year-olds who use condoms and hormonal contraceptive, and to increase the proportion of teens who receive reproductive health information through formal instruction as well as from parents or guardians. The influence of peer pressure on teen behavior has extended from fashion and language to cigarettes, substance abuse, sexuality, and pregnancy. Sexual victimization, either coercive sex or statutory rape, can place adolescent girls at risk for becoming pregnant. A history of sexual victimization will influence a young woman's ability to exert control over future sexual experiences. Approximately 14% of adolescent males have made a female partner pregnant, and 4% became fathers during the teen years. These young fathers face special challenges because of social problems and limited future plans or ability to get support. Young women may ignore early signs of pregnancy, hoping that it will just go away. They may also delay seeking care to keep the pregnancy a secret. Nurses must be sensitive to subtle cues that a teenager may offer. The nurse and the client can explore pregnancy options such as abortion, adoption, and parenting. Pregnant teenagers are considered high-risk OB clients. Many of the complications of their pregnancy result from poverty, late entry into prenatal care, and limited knowledge about self-care during pregnancy. Violence. Teens are more likely to experience violence than older women. Inadequate prenatal care has been negatively associated with health risks to both the mother and the fetus. Teens are more likely than adult women to deliver babies weighing less than 5.5 pounds or to deliver before 37 weeks gestation. The nutritional needs of a pregnant teen are especially important. The teen's lifestyle does not lend itself to overall good nutrition. The nutritional needs of both pregnancy and the adolescent growth spurt require the adolescent to change her diet substantially. Many teens have cared for babies and small children and feel confident and competent. Few teens are prepared, however, for the reality of 24-hour care of an infant. In 2007, 19% of teen births were a repeat birth. Teen mothers who experience a closely spaced second pregnancy or repeat pregnancy have poorer birth, educational, and economic outcomes. Adolescents who become parents may have limited school success before pregnancy. Coping with the demands of childbearing, coupled with immaturity of the younger mother, may make school even less of a priority. Nurses can influence teen pregnancy through appropriate interventions. Nurses visiting families may identify young women at risk for pregnancy. Nurses can offer anticipatory guidance. Broad-based coalitions and planning councils are forming in many areas to facilitate a comprehensive approach to teen pregnancy. The nurse can have a significant role in these coalitions and councils by participating in or organizing community assessments, public awareness campaigns, group education, and interdisciplinary programs for high-risk youths. Nurses can also participate on school health advisory boards.